Harmattan season is here once again, and we all know that this time of the year comes with a weather change that affects the economic, social, and most importantly, the health aspects of our lives. On Matters Arising this week, we will be looking at how people are coping with the weather change.
It's basically dried leaves and having to change a little bit of my skincare routine because of the white skin and all of that. So when the Harmattan comes, we just have to adapt to it. Recently, I just got this lip balm chaplet, and you see it's starting to break and all of that. I'm thinking of getting an oil-based kind of cream for the Harmattan period.
Okay, when it started at first, I had catarrh and sore throat, so I had to be closing my windows every night, and I had to be putting on strong cardigans to protect myself from cold. And since then, I've adapted.
The weather is not friendly at all. But though now currently the weather is not all that harsh, but it's just a little bit of cold, more severe than it used to be.
Actually, I prefer this Harmattan season more than the heat because, as in, if you apply cream, it usually works more than that heat season. And during the heat season, if you are sleeping, you will not be comfortable. But during Harmattan, you just cover yourself up, wear your sweater, you sleep well.
I don't like it, and it causes too much cold, and I have cough, catarrh, but well, with time I will be getting to it, and I have been applying some medication on just to keep my body safe.
Yeah, of course, there are quite a number of them. We have a common cold. That's the most commonly upper respiratory tract infection. Those with asthma, they commonly have exacerbation during this weather, and of course patients with atopy. And then of course we should anticipate a second wave of the COVID-19. And also we have a patient with allergic rhinitis. There is a high turnover of patients these days. And when you go to the accident and emergency, you see quite a number of cases of burns. Yes, these are the common cases that are commonly seen during this weather. Those patients that have asthma and allergic rhinitis, and the patient with atopy, you see quite a number of them coming frequently to the hospital. Okay, so for the patient with asthma, they should try as much as they can to be wearing face mask when they are outside their homes, and we usually talk to them about the precipitants. As such, they should make sure they avoid those precipitants, and the medications they take for the medications that prevent asthma attack, they should try and be regular with their medications so that they won't have asthma attack. For those with allergic rhinitis, again, we talk about face mask. They should try as much as they can to put their mask when outside their homes, and then take their medications as well. We usually give them preventive medications that they will be taking that prevent attacks. So another thing is dry skin. We commonly see people with dry skin. It's becoming worse during this weather, so they should try as much as they can to use Vaseline-based pomades or olive oil that will prevent dry skin.
You're watching this from Solis Based TV. I'm Mary Muhammad Bawa. Don't forget to like, share, and subscribe. Thank you.